More than 121,000 cases of COVID-19 among children in the U.S. were reported last week, and health officials warned it is only going to get worse as kids head back to the classroom. Joining me this morning to talk about this is Dr. Elizabeth Mead, a pediatrician with Swedish Medical Center. Good morning.
Good morning.
So first, we want to ask you about a very powerful Instagram post that you made just a few days ago. Here it is. We're going to throw it up. You wrote in part, "We are back in the thick of it and getting worse fast. Hospitals and ICU beds across the country are full, unable to care for the patients who need them for anything, not just COVID. Healthcare workers are tired, sad, and angry that we are back here again." So that is only just a small snippet of what you wrote there with the picture right there. So can you expand on what this means and where you were coming from and why you posted this?
Oh, sure. I think healthcare workers are just exhausted. I know all essential workers and really everybody is exhausted and tired of dealing with this, but I think that it's just so frustrating as a physician to see our hospitals filling up again, filling up with very, very sick patients, many of whom we cannot save because of this Delta variant, which really is spreading partly because of low vaccination rates, partly because of behaviors like not masking and sort of not adhering to those other strategies of prevention that we've been talking about for so long.
And you've been on the front lines since the beginning, all of this. I mean, I just want to ask you, how are you doing?
It's really hard. I'll be totally honest. I think we're tired. Hospitals are understaffed. Many people have left medicine, they've left nursing positions because it's so stressful and so difficult, and really has been for the last year and a half. I think for a lot of people, it feels like it's a war zone in some ways inside the hospital. And so our hospitals are doing a phenomenal job of caring for the patients and really trying to care for their staff as best as possible. But the reality is that people are leaving because the stress is so great. And I think that we're really feeling the weight of it in a way that just feels very difficult for a lot of people.
Right, and the weight only getting heavier with this whole Delta variant. And speaking of
That's
that,
right.
we're seeing a lot of people really not grasping that the Delta variant is hurting kids. We've seen kids being put on ventilators now. So what is your plea to parents?
Well, I think there's a lot of mixed messages, and I understand why it can be confusing for people. People are hearing that the Delta variant, really in terms of percentage of kids who are getting very, very sick, is the same, and that's true. So I think the good news is that in terms of overall percent of kids who are really severely affected by COVID, the answer is that it's still a low number. But as we see those total numbers of cases go up, so we're now at 6, 7, 8 times what we were seeing in the spring in terms of childhood cases. As those total numbers go up, even though the percentage is staying roughly the same, that total number of children that are ending up in the ICU on ventilators, very sick or potentially dying from COVID, is going up and up. And so I think the reality for parents is that even if that percentage is low, if your child is in that low percentage, it sort of doesn't matter, right? If they're very sick or if they unfortunately pass away.
Right, and with kids going back to school in just a few weeks, what can parents do before they get to that point? What can parents do to keep them as healthy as possible?
It's really the same message that we've been talking about for the last year in terms of layering those strategies of prevention. So we know that masking makes a significant difference. We certainly have great studies in adults that it makes a difference in terms of cutting transmission by about half. And there's some very good data from other states in the country that schools who have universal masking have very, very low transmission rates and sort of outbreak rates compared to schools who aren't doing universal masking or masking at all. So I think that's one of the very most important things that we can do as parents, is to make sure that our kids are masked when they go to school. Again, staying home if you have any sort of symptom or known exposure, washing hands, physical distancing, outdoor time and ventilation as much as possible. All those things, when we put them together, really do a very, very good job of sort of decreasing that transmissibility rate, even with the Delta variant.
And the COVID vaccines, they haven't been approved for people younger than 12. Do you see that happening anytime soon? Have you heard of a timeline maybe of when this could happen?
I wish I had a crystal ball. We have a 6-year-old at my house who is not yet vaccinated, and we're just really waiting for that to come out. I anticipate that it will be probably soon. We're hopeful that in the next 1 to 2 months that it will be approved under the EUA for kids at least down to 5 or 6. And that's in line with what we've been hearing from the FDA and from manufacturers. But I don't have a date, unfortunately. And as soon as we do, we will certainly let everybody know, because I know there are a lot of parents that are really desperate to get their kids vaccinated.
All right, Dr. Elizabeth Mead, we want to thank you so much for joining us this morning. You provided a lot of information, and being on the front lines, maybe people will listen to you.
Thanks so much for having me.